Hi, my name is Rebekah Castillo, and I do give consent to be audio and video recorded. Come in.
Hi, my name's Diamond. I'll be your nurse today. How are you?
Hello, I'm good. How are you?
All right, good. If it's okay with you, I know you're in today to do a physical assessment, so that's what we're going to be doing today. Can I start with your first and last name?
Rebekah Castillo,
And can I have your date of birth?
4/3/86.
Okay, perfect. Everything looks fine and it matches. I'm closing the curtain for privacy. I washed my hands. I'm going to start off with a set of vitals if that's okay with you.
Sure.
I'm going to get your blood pressure. Okay, perfect. It looks like it's 120/84. All right. Respirations, I counted 16. Alrighty. So, if I would take her temperature and if I had a pulse ox, I would then get her pulse ox. I'm just gonna go ahead and get a pulse from here and just count. I'm looking at a clock right now for a full minute. But you can do 30. So right now I'm at for a full pulse measurement, I got 76. All right. Well, I'm gonna go ahead and start with your lymph nodes. So, is it okay if I touch you?
Yeah, that's fine.
Okay. So I'm gonna check 5 lymph nodes of yours. The first one is gonna be the posterior auricular, and that's gonna be behind the ears. Okay. I feel no masses, no lumps, no lesions. I'm gonna do the occipital, which is behind the eyes. Okay, same, no masses, lesions. I'm gonna go ahead and do the submandibular, which is down here, the lower jaw. Feels good. And then gonna do the supraclavicular, and then your thyroid. And can you swallow for me? All right, perfect. And now moving on, I'm gonna go ahead and just do a neural assessment on you. So the neural assessment is going to consume of your cranial nerves. So I'll go down the line from that. So we're going to start with your occipital. We're going to start with 3, 4, and 6 cranial nerves. So all 3, 4, 6 are going to be the 6 cardinal fields. So you can go ahead and follow my pen light. Okay. Eyes are equal. It's moving okay. Now I'm going to go ahead and move on to cranial number 8. And that is me performing the hearing test. So I'm going to whisper in one ear and let me know if you can hear what I'm saying. Can you cover your other ear while I whisper in the other one? What did I say?
Oranges and apples.
Okay, perfect. And now the other ear, just to make sure the accommodation is all right.
Zebra blue.
Okay, perfect. So now we're going to move on to cranial nerve 9, which is your facial. Can you smile for me? Can you frown? Can you show your teeth? Can you puff your cheeks? and you're blinking your eyes, which is good. That's intact. Olfactory. We're gonna do olfactory right now. I don't have an alcohol wipe, but I'm gonna put hand sanitizer on it. Can you tell me if you could smell?
Mm-hmm.
Can you cover one nostril? Do you smell okay?
Mm-hmm.
And the other one?
Mm-hmm.
Okay, perfect. Now I'm gonna move on to cranial nerve 9 and 10, and I'm going to have you say ah.
Say
Perfect. And stick your tongue out and move it side to side. Okay, and then I did also, if I was also assessing the other cranial nerve in this area, it would be the gag reflex, and she's okay in that area. I'm going to go ahead and do cranial nerve 12. Actually, I just did cranial nerve 12, and that was sticking the tongue out from side to side. And now cranial nerve number 5 is going to be the trigeminal. And let me know if you close your eyes and let me know if you can feel something sharp or soft.
Sharp. Soft.
Yes. How about now?
Sharp.
Yeah. She's a little shaky in that area. Okay. And now the last cranial nerve is going to be number 11, and that has to do with the shoulder. Oh, you can open up your eyes. 11 is going to do with the shoulders, and that's the accessory one. And if you can you shrug up your shoulders and down? Okay, perfect. And no pain anywhere of where I did any of the... Do you have any pain today?
No.
Okay. Now we're going to go ahead and move on to... I'm going to go ahead and move on to mobility, which is a musculoskeletal. And I'm going to first inspect. So now I'm looking at the head. As we were doing some of the cranial nerves, I was inspecting at the same exact time. So if you can you move your head from side to side for me? Beautiful. When I did the shoulder, when I was assessing cranial nerve 11, I was looking at her shoulders to make sure that the alignment was okay back there, but I'll just go ahead and check again. Can you sit up a little bit? Okay. Do you have any back problems, any scoliosis, anything?
No.
Okay, I'm looking at the spine. It looks symmetrical and it looks okay. And now I'm going to perform some muscle strength on your hands. I'm just going to see the grips. So if you can you squeeze my hands? Okay, perfect. I'm going to go ahead and say it's equally strong bilaterally, a +5. And now I'm going to go ahead and inspect the lower body. So I'm looking at any lumps, lesions, cuts, or bruises. And I don't see anything. Oh, I don't see anything there. So I'm going to ask if you could actually push against my hands. Okay, great. And now that's also +5. I'm going to do the same for the feet. Okay, push. Okay, perfect. All right, and now I'm going to go ahead and check your pulses. So I'm going to palpate for the carotid arteries one at a time. And I'm doing this because we cannot do it at the same time.
Why not?
Because you'll probably pass out.
Oh.
Feels good. Nice and strong. Feels great. All right, and now I'm going to listen, actually. to the carotid. Okay. And I felt no masses, lumps, lesions, no bruising. And now I'm gonna do the upper extremities for the pulses. So we're gonna start with the brachial. And now we're gonna do the radial. Strong. And a cap refill. Less than 2 seconds for each. Now I'm going to go ahead and move on to the lower extremity pulses. And so I'm going to check the popliteal. Put your both. Okay. Now the dorsalis pediis. And the posterior tibial. Wait, hold on. Let me feel this. Okay. +5 on all. Now I'm going to move on to the cardiac, and I'm going to listen to your heart sounds. First, I'm inspecting to make sure that there's no masses, pulses, or heaves anywhere. And I'm going to feel that there's nothing here. And I feel nothing, any tenderness, anything hurting? Okay. And now I'm going to go ahead and listen to the heart sounds. So we're going to start with the aortic, move down to the pulmonic, the Erb's point, and tricuspid. Okay. Alright, and now I'm going to listen to your apical pulse for a full minute. Okay, I'm going to listen to your apical pulse for a full minute. Okay, that was a full minute, and I counted to 81. Now, I'm gonna verbalize the need to assess for murmurs in each of the 5 cardiac areas, and I would be using the bell, the stethoscope, and I would be placing the patient in sitting lying position on the left side line, looking for any murmurs. The last 1 hour assessment is going to be your abdomen. Can you please lay for me? Any past surgeries in the abdomen area that I should know about? Okay, perfect. So now she's in a supine position as much as she can be, and that's because this is making sure that the abdomen muscles are relaxed at this time during my assessment. And right now I'm just gonna inspect for any wounds, cuts, scars, lesions, drains, ostomies. Okay, so now I'm looking right here. I see nothing. Looks good, just a little bit of tattoos. No scarring, no cuts, no lesions. Now I'm going to go ahead and listen for the presence of an abdominal aortic root. Okay, no root present. Now I'm going to go with listening to every quadrant of your abdomen to listen for vowel sounds. Okay, I heard gurgling in all the quadrants. I would say it's pretty normal. If I did not hear any gurgling, I would listen for 5 minutes to make sure I did not hear anything there. Now I'm going to percuss the abdomen. Any pain? Okay, feels good. Her belly's not distended, and it feels nice and soft. When was your last bowel movement?
Today.
All right, perfect. And you're eating and drinking okay? All right. And then
Too much.
okay. And now I would assess for any dorsovertebral angle tenderness bilaterally. Does anything hurt?
No.
Okay. All right. And do you have any questions?